Top 7 minerals every diabetic must take. Lower blood sugar. Most diabetics focus on cutting carbs, taking meds, and tracking blood sugar. But have you ever wondered if something bigger is flying under the radar and sabotaging your progress? Stick around, because by the end of this video, you'll discover 7 key minerals that could completely change how you manage diabetes. Trust me, you don't want to miss the mineral everyone forgets about. Your health might depend on it. Most people with diabetes overlook minerals. Even though these nutrients keep insulin efficient, protect nerves, and help prevent complications. The shocking part? Many diabetics are low on the exact minerals that most impact blood sugar control. If you're missing them, managing diabetes becomes an uphill battle. Today, we're covering 70 minerals every diabetic needs. If you're constantly tired, dealing with body pain, or struggling to control your blood sugar, this video could be the lifeline you've been searching for. Stick around, because I'll also share the best foods and supplements to make sure you're not running low. Ready? Let's dive in. Number 1. Magnesium. Magnesium is a mineral you rarely think about until it's gone. And if you have diabetes, you lose magnesium faster than most. High blood sugar forces your kidneys to flush out excess glucose, which also carries away valuable magnesium. Over time, that depletion makes stabilizing blood sugar even harder. Low magnesium worsens insulin resistance, leaving blood sugar levels higher and triggering even more magnesium loss. A vicious cycle that's often overlooked. The warning signs can seem like everyday annoyances: muscle cramps, especially in the legs and feet, constant fatigue even after a good night's sleep, and nerve issues like tingling or numbness. Anxiety and insomnia can creep in too, because magnesium calms the nervous system. When it's gone, stress hormones run the show. But the damage goes deeper. Fertility in men and women dips when magnesium levels plunge, and libido suffers because magnesium helps balance hormones. Nerve pain flares up, kidney stones become more likely, and eye health deteriorates under oxidative stress. The heart and blood vessels also take a beating, because low magnesium leads to stiffer arteries, spikes blood pressure, and increases the risk of heart attacks and strokes. On a cellular level, magnesium helps insulin unlock cells so glucose can get in. Without enough, you're left exhausted and more prone to inflammation. Pumpkin seeds, cooked spinach, almonds, dark chocolate, and avocados all pack a solid magnesium punch while supporting blood sugar control. If you're looking for a supplement, magnesium glycinate is easy to absorb and gentle on the stomach. Reputable brands include Thorne Magnesium Bisglycinate or Doctor's Best High Absorption Magnesium, both around 200 milligrams per dose. Avoid magnesium oxide, which offers poor absorption and can upset your stomach. Processed carbs, high sugar intake, and caffeine can all sap magnesium. Alcohol depletes it further, and excessive calcium supplements can block its absorption. If you're constantly feeling sore, drained, or battling unstable blood sugar, boosting magnesium might be the key you've been missing. 2. Zinc. Zinc is another underrated powerhouse. Diabetes causes frequent urination and chronic inflammation, which flush out and burn through zinc much faster than normal. Your pancreas needs zinc to release insulin properly, so when zinc levels drop, blood sugar control goes downhill. Deficiency clues can be subtle: slow wound healing, more frequent colds, persistent sugar cravings, and skin issues like dryness or rashes. Hair might thin, taste and smell may dull, and small cuts just won't heal. Low zinc hurts fertility in both men and women, drops libido, and worsens nerve pain. It also compromises kidney function and can accelerate eye problems like diabetic retinopathy. On top of that, zinc helps keep inflammation and artery stiffness at bay, lowering your risk of heart disease. Zinc assists insulin in binding to receptors. Low zinc, weaker insulin response. Simple as that. It also fights oxidative stress, So when zinc is missing, your cells take a beating and age faster. Oysters top the list, followed by beef liver, pumpkin seeds, grass-fed beef, and chickpeas. If supplements feel more convenient, look for zinc picolinate or zinc bisglycinate at doses between 15 and 30 milligrams daily. Thorne Research zinc picolinate and Now Food zinc glycinate are both good options. Just remember, long-term zinc use should be balanced with copper because they compete for absorption. High-sugar diets crank up insulin demand and flush out more zinc. Whole grains and legumes contain phytates that interfere with zinc absorption unless you soak or sprout them. Alcohol is a big culprit here, too. And processed junk food? It just robs you of nutrients while inflaming your system. 3. Chromium might not be top of mind, but it's critical for diabetes management. Every time blood sugar spikes, your kidneys work overtime, losing chromium in the process. This mineral is essential for helping insulin move glucose into your cells. Without it, insulin can't do its job, and blood sugar remains stubbornly high. Telltale signs of low chromium often mirror regular diabetes troubles. Higher blood sugar readings despite no change in diet or meds, extreme sugar cravings, and fatigue. Some people get mood swings or anxiety because chromium is tied to brain function. In severe cases, you might notice tingling in your hands and feet. Low chromium hurts fertility by lowering testosterone in men and messing with hormones in women. It also harms nerves, speeds up kidney damage, weakens vision, and raises heart risks by affecting cholesterol and fat metabolism. On a cellular level, chromium is part of the glucose tolerance factor, which makes insulin more effective. Broccoli, grape juice, in moderation, Brazil nuts, lean beef, and eggs contain chromium. If gourmet dishes interest you, a Japanese Wagyu steak with broccoli or a Mediterranean lamb chop with a little grape reduction sauce can help. For supplements, chromium picolinate or polynicotinate are best. Now Foods chromium picolinate 200 micrograms or Thorne Research chromium picolinate 500 micrograms can cover most deficiencies. Watch out for sugar, processed carbs, and too much dairy. These all hinder chromium. Alcohol depletes it even faster. Naka Iwir 4. Calcium. Though calcium is well known for bone health, diabetics can't overlook it. Proper calcium levels help regulate heartbeat and muscle function, including how muscles respond to insulin. But be careful. 2. Much supplemental calcium can interfere with magnesium and zinc, throwing your balance off. Low calcium can make nerve signals erratic, lead to muscle spasms, and hurt bone density over time. In combination with vitamin D, however, calcium supports insulin sensitivity. Foods like dairy, in reasonable amounts, sardines, tofu, and leafy greens can help, but remember, synergy matters. If you're overloading on calcium, you might sabotage other minerals. Necrofer 5. Potassium. Potassium is often overshadowed by sodium, but it's vital for nerve function and muscle contractions. In diabetes, high blood sugar can cause frequent urination, washing out potassium. Low potassium leads to fatigue, cramping, and even irregular heartbeats. It also affects how cells use glucose, indirectly influencing insulin efficiency. Bananas, spinach, sweet potatoes, and beans are good sources, but be mindful if you have kidney issues. Too much potassium can be harmful. Keep an eye on your blood levels if you supplement. 6. Manganese plays a big role in metabolism and antioxidant defense. Diabetics often have lower manganese because of poor diet or high oxidative stress. Deficiency can worsen insulin resistance and increase nerve damage risks. Foods like brown rice, pecans, and oatmeal provide manganese, but watch out for phytates that block absorption. Manganese helps process carbs, so getting enough can make a difference in how you handle blood sugar spikes. Bracker 7. Selenium. Selenium is a potent antioxidant that protects cells from oxidative stress, a huge problem in diabetes. It also supports thyroid health, which indirectly influences metabolism and insulin sensitivity. Low selenium may worsen neuropathy, eye issues, and overall inflammation. Brazil nuts are famously high in selenium. Often just one nut can meet your daily requirement. But don't go overboard, because too much selenium can be toxic. Keeping a balanced intake boosts immunity, protects the heart, and can give you an edge against diabetes complications. If this is starting to feel like a lot, it's because it is. Diabetes isn't just about carbs or insulin shots. It's about the entire nutritional picture, especially these 7 minerals. Missing any of them can trigger a chain reaction that leaves you tired, in pain, and struggling to keep blood sugar in check. Here's the good news. Armed with the right foods and targeted supplements, you can stop these deficiencies from derailing your progress. Whether it's magnesium for stable blood sugar, zinc for immune strength, chromium for better insulin action, or making sure calcium, potassium, manganese, and selenium stay in balance. Every mineral has a role. If you found this video helpful, give it a like and leave a comment below. Which of these minerals do you suspect you're low on? And here's the big question. Could fixing just one deficiency be the hidden key to your best health yet? Share your thoughts, because I'd love to hear what you think. Finally, if you're serious about mastering diabetes, subscribe. And stay tuned. We've got more game-changing insights coming soon. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.